Hello, my name is Nicole and I'm studying medicine at Anáhuac Querétaro University. The topic of today is about communicating bad news to our patients. Communicating bad news to our patients is one of the most important things we should do as doctors, as important as any medical intervention. The attitude, communication skills, and empathy of the person giving the bad news plays an important role in the coping and loss skills of patients and their families. As physicians, we must understand the psychosocial context of our patients' lives and the relationships of trust that we develop with them over the years. These two factors help us to determine more easily how bad news should be delivered and predict how it will be accepted. It is now known that providing a therapeutic presence at this time in patients can be extremely rewarding, both professionally and personally, and adopting an individualist and systematic approach to delivering bad news can improve their confidence and reduce the patient's suffering. The important characteristics of the communication of bad news include the attitude, the sympathy, and the sincerity of the person who gives the news, the clarity of the message, and the attention to privacy. The knowledge and ability of the respondent to answer questions are also important, so we must make sure to review the patient's history and be prepared to offer at least basic information about the prognosis and therapeutic options. In the present world, we will try to explain a method that structures bad news interview in 6 steps. In each step, the ethical issues that are addressed will be specified in detail. First step, preparation of interview. The encounter must be prepared in advance and contact with the patient must be established. Choose an environment that facilitates the exchange of information. We will assess if the patient is prepared to receive this information. We will look for a quiet place with few interruptions. The patient will be asked what people they want to be present. We will try to maintain visual contact throughout the interview. The ethical aspects about this step is that the autonomy of the patient must be respected. This means that the physician must respect the choice of the patient at all time, whether he chooses to be alone or accompanied, or simply decide where and when he wishes to be offered the news. Step 2. Know what the patient knows and his perception of the disease. Understanding the patient's perception of his condition better helps us to determine our starting point based on what the patient already knows. Step 3. Warning shot. It means saying something that prepares the patient and his family for the news he is about to transmit. A pause must be made because the news has been delivered. The emotional response has not yet arrived. Step 4. Diagnosis in normal terms. Medical terminology is avoided and it is expected that one's common words with emotional charge are used. The patient will not hear much more during our conversation. Step 5. Shut up and listen. Let the patient make the next move. If there is no response after prolonged silence, the patient is asked if it is good to validate and normalize the emotional response. Personal statements are valid if they are true, but be sure to not discuss or criticize a colleague's medical care. This doesn't help the patient and can make the situation worse. The ethical aspect about this is that in medical care, patients trust adequately for their protection in the personal and professional integrity of their doctors. A crucial aspect of the integrity of the part of physician is the willingness to refer the specialist when the limits of their own knowledge are addressed, to focus primarily on the interest of the patient as a way to mitigate the mere personal interest, and avoid conflicts of interest and situations that exploit others, creating reasonable expectations or distort information. The step 6 is about providing additional information if it is requested. The patient has the option to request more information if he wants. It is important to give the patient a realistic hope and avoid false hope. It conveys more optimism than it is realistic. The patient and family could delay proper planning and feel betrayed when they discover that death is near. And the last step is about to establish a therapeutic plan and summarize the situation. The treatment recommendations are exposed, making sure that the patient understands them, that the treatment options are provided and agreed, and that we understand their concerns and communicate our role. Our availability of support and contact guarantee, personal and team, must always be explicit. This follows the principles of beneficence and non-maleficence.